If you're looking into ADHD treatment, especially for your child, there's a good chance Concerta has come up. Maybe you've heard of it called methylphenidate ER or confused it with Ritalin LA, but Concerta is its own thing. A long-acting, smoother version of methylphenidate that's become one of the most trusted first-line options for children, teens, even some adults who have ADHD. I'm Dr. David Danish, a double board certified psychiatrist specializing in child, adolescent, and adult ADHD. I prescribe Concerta to thousands and thousands, tens of thousands of patients at this point. So let me walk you through what really matters, what works, what's tricky, and what to watch out for. Concerta is a long-acting stimulant that contains methylphenidate, the same active ingredient in Ritalin. It's FDA approved to treat ADHD in children, adolescents, and adults up to the age of 65. Here's what makes Concerta stand out: the delivery system. Concerta uses something called OROS technology. Picture a capsule within a capsule that acts like a mini pump. About 22% of the medication is released immediately, while the remaining 78% is slowly released through a tiny laser drilled hole over the next 8 to 12 hours. That gives patients one of the smoothest stimulant experiences out there, with fewer crashes or roller coaster effects that traditional Ritalin or even Adderall extended release can provide. Another thing, because Concerta is a methylphenidate-based compound, not an amphetamine, it tends to be gentler on average, especially for patients with anxiety, mild heart concerns, or patients under 18. Unlike amphetamine-based stimulants, which both block the reuptake of norepinephrine and dopamine and stimulate the release of those same neurotransmitters, methylphenidate-based compounds just block the reuptake. So that confers maybe a little bit less efficacy on average, but also usually less side effects on average compared to the amphetamine class. Clinically, I might sometimes use this off-label for someone who has narcolepsy or treatment-resistant depression with low motivation, and sometimes even for mood or impulse-related disorders like disruptive mood dysregulation disorder or intermittent explosive disorder. But those uses require careful case-by-case discussion. Let's get into side effects a little bit. The three that I tend to see the most in my patients usually show up early. They're usually very mild. They usually dissipate with time. There can be mild stomach upset, so I often recommend taking it with some food. A lot of patients will complain of lower appetite. This tends to occur in my patients who already have a baseline low appetite, those naturally skinny ADHD kids and teens who tend not to eat well anyways. Of course, they're the ones who have more side effects when it comes to appetite suppression. I do have a great resource that I can provide for you in the show notes that talks about great ways to get around this, to add on healthy, high-calorie snacks and what those snacks are. So again, look at the show notes for that. Other side effects that can occur with stimulants that are not unique to Concerta, the insomnia if it lasts too long in their system, or if the dose is too high, or if you take it too late in the day. It should always be taken in the morning, so you don't take it after lunch and then it lasts till midnight, obviously. Some patients may have worsening irritability on stimulants, so that needs to be looked at. If you take the medication or your child takes the medication and 2 hours into the dose, they're much more irritable, much more activated, then obviously it's a bad fit. If on the other hand, they're only getting irritable when it wears off, that wear off time varies from patient to patient. Sometimes it's 2 p.m., sometimes it's 6 p.m. based on how quickly they break it down. But if there's a wear off irritability, there are many other strategies that can be employed. It could be that you need a longer acting medicine, such as focal and extended release. It could be that you need to use a short acting medication of methylphenidate immediate release in the afternoon. It could be that they're hangry. In other words, they haven't eaten a good lunch and they need to eat a snack when they get home. So there are a lot of options there to consider. Now, some of the rare but serious side effects that are common to all stimulants, not just Concerta, I want to mention them here even though they rarely occur. Tics or worsening tics can occur, such as movement tics, eye blinking, or grunting, verbal tics, especially in a person who has a family history of Tourette's. Aggression, irritability, again, very rare. Usually these actually lessen the chance for aggression and irritability if that's already occurring because of ADHD. But if it makes someone manic or irritable because it hits them the wrong way, then again, it's a bad fit. EKGs are sometimes needed if you know your family has a strong history of arrhythmias, abnormal heart rhythms, cardiac death from other causes, then of course get an EKG before taking a stimulant. Also, once the stimulant is started, if you never got an EKG but suddenly you develop any kind of palpable palpitations, funny heart feelings, funny chest feelings, or chest pain, of course, stop the medicine, talk to your practitioner about what to do next. Now, stimulants and substance use. One thing I really want to emphasize here is one, Concerta's OROS design does reduce misuse potential, which is great. I do use it in some patients who have a history of drug addiction. The other thing I want to note, study after study after study shows that if you treat someone who has legitimate ADHD with a stimulant medication, you greatly reduce the chance that they are going to abuse drugs and or alcohol. That is for sure the truth. It's also what I see in my practice. So when patients come to me with this misinformation that stimulants will predispose them to drug use, of course, that can occur in some people, just as it's true that some people might die from drinking too much water. That's happened in dozens of cases in the past 10 years. But the research shows, in general, if you treat the ADHD with a stimulant or with a non-stimulant, it lowers the risk that they're going to get into addiction across all substances. Okay, this covers some of the main side effects and then some of the more concerning side effects. But of course, I created a full list of all potential side effects, as well as more details on when to get an EKG before or after starting the medication. And again, that's going to be in my free Mind Vault resource. This one is on Concerta, and I'll put that in the show notes as well. So Concerta, in my practice, it's one of my go-to first-line options for treating ADHD in people under the age of 18. It's smoother delivery, gentler side effect profile, and consistent effects over the course of the day make it a great place to start. The dose range is very easy to use. It's 18 at the low end, 72 milligrams at the high end, with all kinds of doses in between. Now, the medication cannot be split, it cannot be chewed. It has to be swallowed whole. So that's one downside. If patients have trouble taking medications, there are many other options out there, including, for instance, chewable Ritalin, as well as focal and extended release, which can be opened up. Overall, Concerta tends to produce fewer emotional dips, fewer emotional highs compared to other stimulants. That said, among some of the other medications in the methylphenidate class, such as focal and extended release and Astaris, it is a little bit shorter acting, so if you are getting too early of a wear-off, or if you're getting a wear-off crash and wear-off irritability in the afternoon, you might consider one of those other options. Thank you for watching this video. Please like it, please subscribe so I can get the word out there. Please share it with anybody else who might find it helpful. Also, I want to make sure you know about executive function and executive function coaching. ADHD treatment with medications is amazing what it can do, but it's really only half the battle. Executive function coaching makes up for most of the rest. Stay curious, stay informed, and I'll see you in the next video.